Hi everyone, welcome to my theatre. In this movie, we will be learning about color blindness. Well, the world is beautiful because of colors. And what if a person is color blind? It's gonna be sad, isn't it? Okay, so before we start the topic, I will show you a very sweet clip of Ed Sheeran, which is one of my favorites. Okay, so even though the colors make the life beautiful, but still sometimes people opt to be colorblind intentionally. Well, it's their choice, okay? Okay, so basically when we are talking about color blindness, the first thing we need to know is how do we appreciate colors? Why do we appreciate colors? There must be some structure in the human body which is helping us to appreciate colors. And what is that structure? That is one of the layers of the retina. Well, the retina has 10 layers, and among them one of the layer is the layer of photoreceptors, that is the rods and the cones. And it is because of the cones we appreciate color. Now, what are the colors that we appreciate? You will say that a whole spectrum of colors we appreciate. Yes, you are right. But the whole spectrum is based on three basic colors. And what are those three basic colors? They are red, green and blue. The red is protan, green is deuteran and blue is tritan. And because of the mixing and matching of this red, green and blue, we get the rest of the colors. And if there is any problem in appreciation of any of these colors, we call it the anomaly. And if the appreciation is completely absent, we call it anopia. If there is any problem, we call it anomaly, and if there is complete absence of appreciation of the color, we call it anopia. So what is anomaly? It can be protanomaly, it can be deuteranomaly, it can be tritanomaly. But if there is complete absence, it can be protanopia, it can be deuteranopia, it can be tritanopia. Either it's defective or it's completely absent. And on the basis of these three colors, rest all the colors are formed. The entire spectrum of color is formed from these three basic colors. And how do you remember? There is a good mnemonic for it. And what is that mnemonic? The mnemonic is really good basics in PDT. You need a really good basics in PDT. So what is that? RGB PDT. Red, green, blue and PDT. That is protanomaly, deuteranomaly and tritanomaly. Okay. Now, since we are done with this, next we will move on to two major kind of color blindness. Well, there are many diseases where we see a color vision defect, but the whole spectrum of diseases of color vision defect is broadly divided into two categories. One is the congenital, one is the acquired. Congenital, as the name suggests, is present since birth. Acquired is acquired at one point in life. Congenital means it has to be bilateral. Acquired is unilateral. Congenital is usually the person doesn't know that the person has any defect because the person is born with that. In acquired, the person knows that there is some problem which has developed at certain point in time. Then congenital has some inheritance pattern which is usually X-linked recessive. Acquired may or may not have any inheritance pattern. Congenital is usually the cone dystrophy, whereas whereas the acquired can be some optic nerve pathology or can be some macular pathology. The congenital usually has a red-green pattern of color blindness, whereas when we talk about acquired, the acquired can have a red-green pattern in case of optic nerve pathology, and it can have a blue-yellow pattern in case of the macular pathology. And congenital we cannot treat, whereas acquired we can treat depending upon the cause. So these basic things let us know. Okay. So congenital what? It is a cone dystrophy. Basically, the problem lies with the cone. Whereas when we talk about acquired, the acquired can be a macular pathology or an optic nerve pathology. Now when we talk about the symmetry, the congenital, when we talk about the symmetry, the congenital is symmetrical. Usually it is present in both eyes, whereas the acquired is asymmetrical. Inheritance, congenital is X-linked recessive. Acquired usually doesn't have any inheritance pattern. Age, usually since birth, and acquired can happen at any age. Congenital is more common in males, and acquired can be seen in both the genders equally. When we talk about the color, usually the red-green is associated with congenital, whereas when we talk about acquired, it is the blue-yellow in case of macular pathology and red-green in case of optic nerve pathology. When we talk about the visual acuity in congenital is diminished. No, it is not diminished in congenital. In acquired, it can be diminished. Investigation, well, when we talk about the photoreceptors, you will learn it subsequently when you learn about retinal investigation, that whenever the photoreceptors are involved, the investigation of choice is ERG. So we do a ERG in case of congenital defect, whereas in case of acquired defect, we don't do anything. Knowledge in congenital defect is not there. It means the person doesn't know that the person is colorblind. It is usually detected during a routine examination, whereas in acquired, the knowledge is there. For congenital, how do we treat? We usually don't have any treatment, but for acquired, we can treat by treating the cause. Okay, so these are the basic differences between the congenital and acquired color blindness. Now that we know that there are three types of colors and these are the broad categories of color blindness, let's switch over to the tests that we do for color blindness. Well, all the tests that we do for color blindness can be broadly categorized into three types. One is the tests which are done for screening. The second is the tests which we do to detect the quality, which means what kind of color blindness. And third are the tests which quantify the extent of color blindness. So one is screening, one is quality, and one is quantity. So these are the three kinds of color blindness. So now what are the tests for color vision? The tests for color vision are FANA. I have created a mnemonic for you so that it gets easy for you. So FANA city is Harry Potter Nagini's home lantern. FANA city is Harry Potter Nagini's home lantern. So basically there is a FANA, you know that Harry Potter has a character known as a Nagini. So Nagini needs a lantern in her home, but then the FANA city is so well lit that it acts as Harry Potter Nagini's home lantern. So that's the way to remember, so that you can answer it, like you won't get confused in the exams, and you can also answer a theory question if you're asked. And as I said, every test is not important for you. I will mention which test is important for you, but then for rest of the test, knowing the name should be enough. Okay, so what are the tests? FANA is Farnsworth 100 hue test and Farnsworth 15 hue test. City is City University test. Is Ishihara test. Harry Potter is Hardy Rand Rittler test. Nagini is Nagel's anomaloscope. Home is Homer Walgreen test. And then finally, lantern is lantern tests. Okay, so these are the tests which we do for color vision. So FANA is Farnsworth 100 hue test and Farnsworth 15 hue test. City is City University test. Is Ishihara test. Harry Potter is Hardy Rand Rittler test. Nagini is Nagel's anomaloscope. Home is Holmgreen wool test. And lantern is lantern test. Okay. So as I said, every test has its own importance in terms of whether it's for screening, whether it's for confirmatory, whether it's for qualitative, whether it's for quantitative. But among them, the most important test that we use in a day-to-day basis for screening and for knowing if there is any color vision defect in the patient is your Ishihara test. So this test is the most important test that is being done. Other than that, one important test is the lantern test. Why it's important? It's because it's routinely used for screening the Navy, Army and the Air Force individuals to know whether they are able to detect light signals which come from the distance. But each and every test, as I said, is special in its own way. So we'll learn a little bit about each, and then finally we will move on to the Ishihara, which is the most important. So first, the Farnsworth 100 hue test. Well, there are 100 kinds of colors and the patient is asked to match each color with one of the colors. So among the 100 colors that is present, the patient will be asked to match one color with each of the color, which means the patient will have to sit for a long time to get this done. Usually we don't use 100, we usually use 85 plates here, and the patient is asked to match those 85 plates. Since a lot of colors are being asked to match, this test is very sensitive, but it's going to be cumbersome. It takes a lot of time for the test to do. So a little bit of modification has been done in this test, which is your Farnsworth 15 hue test, where only 13 plates are used and the patient is asked to do the same matching as in 100 hue test. Since less number of colors are used, the sensitivity goes down, but since the numbers are less, it takes less time. Next is your City University test. The City University, Ishihara and the Hardy-Rand-Littler, all three tests are pseudo-isochromatic tests. Here, the Ishihara is actually a screening test. City University and HRR, they are more confirmatory. They help us to know whether the patient is like what kind of color blindness and all other stuff. They give information, but Ishihara is just a screening test. And this Hardy-Rand-Littler has importance in screening the illiterate people. Okay. So now before going to the Ishihara, we will learn the rest, couple of tests that are left, and then finally we'll come on to the Ishihara. So what are the rest of the tests? One is Nagel's anomaloscope. The Nagel's anomaloscope is a very beautiful equipment, and in fact it is the gold standard for color vision assessment. It is the best test, but it is not available everywhere. It is a very costly equipment which is present only in few labs in the world. But otherwise it's a very gold standard test where the green and the red are mixed to produce the color yellow, right? But and there is a scoring system where when the score is less than 0.7, we call it red color blind. When the score is more than 1.7, we call it green color blind. So basically there is a scoring system, and based on that scoring system, we talk what kind of color blindness the patient is having. Fine. But as I said, even though it is gold standard, it is not available everywhere. Now, the home green wool test. The home green wool test is a test where again the wools are present and the color is asked to match with each wool. And this test is again a spectroscopic test because we are checking the spectrum of colors, and this can be done. And finally, the lantern tests. As I said, the lantern tests are important. Why they are important? Because they actually do not assess the color vision, but they assess the power of an individual to identify a light signal which is coming from a distance. If the individual is able to identify the light signal, then the person is eligible to be a train driver or work in the Air Force, work in the Army, because they need to appreciate colors. For example, red light is shown from the distance, then the person should know that there is danger. So this test usually helps us to know whether the person is able to appreciate the light which is thrown from a distance. That's why how do we do the test? We make the patient sit in a dark room for 30 minutes and we ask so that the person gets dark adapt. We switch on the computer, increase the brightness to the highest, and then check this. How do we check? We usually, this is present in the screen, and usually there are two dots, and the patient will be asked to identify the color of the upper dot and the color of the lower dot and mark it here. And depending upon how particular the person is, how well the person has performed, we give a ranking, and higher the ranking, the better the person has performed. Fine. And now let's move on to the most important test. Why it's most important? It is a screening test, but this is the test which we usually use in day-to-day practice because it's easy, and but it is a screening test, and that test is the Ishihara test. So what is the Ishihara test? The Ishihara test is a test which has a booklet with 38 plates. The ideal one has 38 plates. There are variations that exist which can have less than 38 plates, but the ideal one has 38 plates. And these are different kinds of, and this is how the plates look like. This is how the plates look like. Among the 38 plates, we have few plates for illiterate, few plates for diagnosis, few plates. So there are different kinds of plates which does different kind of job. And how do we test? Usually we test it in white light. We don't test it in yellow light because yellow light is going to skew the findings. We test it in white light, the patient being seated and the chart being given at a reading distance. And then we ask the patient to appreciate what is written in each and every plate. And after that, we assess we then try to find out what exactly the problem is or whether there is any problem present or not. Okay. And if you talk about the plates, as I said, there are 38 plates. After 25 till 38, the plates that are present are tracing plates, which is mainly meant for illiterates. So after 25, all the plates are tracing plates, which is mainly for illiterates. 22 to 25 are the diagnostic plates. Why? Because they help us to diagnose if there is any red-green color deficiency. So they are known as the diagnostic plates. And if the person sees the first one faded, then it is protanomaly. And if the person sees the second one faded, it is the deuteroanomaly. Like there are two digits, right? And if the person says that I see the first digit faded, then we say that it is protanomaly. If the person says that the second digit is faded than the first, we call it deuteroanomaly. Now 18 to 21 is the hidden plates, which the colorblind can see. A person who is colorblind can see, but we cannot see. A normal person cannot see. And 10 to 17 are your vanishing plates. In vanishing plates, again, the colorblind, they are vanished for colorblind. The colorblind cannot see. In this case, the colorblind person cannot see those plates. They are vanishing plates. 2 to 9 are your transformation plates. As the name suggests, they are transformed for colorblind, which means the colorblind sees them differently from the normal individual. Okay? The colorblind sees them differently from the normal individual. And finally, the first is the demonstration plate, which is plate number 12, plate number 1, where 12 is written. And this everybody can see and read. Everybody, whether it's a colorblind, whether it's normal, everybody can appreciate that color. Okay. So this is about the plates. And again, as I said, you don't have to remember this. You can fix a chart in your OPD so that whenever you are testing, you can go through, or maybe at in the last page of Ishihara, you can fix this chart so that whenever you're doing the test, you can go through the interpretation and give. But in theory exams, you can write. But as I said, it's good to use the knowledge in a wise way. So why mug up? Why mug up unnecessary things, right? Now, how do we, what judgment do we do? The judgment that we do depend upon where we are staying, what kind of work we are doing, which means different country has different guidelines for color blindness. That's point number 1. And the second important point is different profession has also different guidelines for color blindness. Like, for example, we have like India, we have CP1, CP2, CP3, CP4, and we say that CP1 has the most stringent guidelines, and CP1 can be applicable for Army and Navy, and CP3 can be CP1 for Navy and Air Force, and CP3 for Army. But again, as I said, it depends upon the profession, it depends upon the country. So whenever you're testing interview, for example, if you're working in the Army hospital, accordingly you have to do. You're working in the Navy setup, accordingly you have to give a judgment. So this is how we do it. Fine. So this was all about the very interesting topic known as color blindness. Just know the name of the tests, know about Ishihara in a bit more detail, and know about lantern test, and rest just know the name and what they do briefly you can know. I hope you enjoyed. We'll catch up soon. Thank you.